discussion around metabolic syndrome. It's obviously a very, very topical issue. And there's been a lot of discussion around metabolic syndrome and schizophrenia with antipsychotic treatment. What are the key causes for the development of metabolic syndrome in schizophrenia with antipsychotic medication?
Well, first of all, we need to consider that metabolic syndrome is caused by multiple pathways, and one of them is maybe genetic underlying risk. There are people without the illness of schizophrenia or without antipsychotics might develop metabolic syndrome. Then there is the illness itself, and stress might actually cause metabolic syndrome. Then we have mental illness that's related to sedentary lifestyle and also some poorer food intake. And finally, we have iatrogenic effects where medications can cause or lead to parts of the metabolic syndrome. And medications, not only antipsychotics, can cause an increase in appetite, food intake, and weight gain. Some antipsychotics have that more than others, and they're usually the ones that are also more sedating, because sedation linked to histaminergic blockade makes you basically move around less, but also most likely eat more. And that's one pathway to metabolic syndrome, that you have abdominal girth increase, you have abdominal obesity. You might then also develop secondary effects on insulin resistance, increase in lipids. However, there might also be, or there's now data to suggest that there's a weight-independent effect that some antipsychotics have and others don't have as much, that actually alters the oral glucose tolerance test adversely and increases lipids, even within a few days.